So as fronts, you're going to occasionally be requested to come and help the doctors or the hygienists, especially with what's called periodontal charting. So periodontal charting essentially measures bone loss or inflammation around people's teeth. So in order to do periodontal charting within EagleSoft, um, you'll have a screen opened up that looks similar to this, and I'll show it to you inside of EagleSoft. But there's two buttons that basically you might be used. Most of the time you're looking at just pocket depths, but sometimes a hygienist will request you to use this gingival margin, which is essentially it's tracking patient's recession. So when you open up the screen, you're going to see this little highlighted icon here. And what that is basically there's 6 points that they're going to measure. And you can see here that this is the buccal or the cheek side of the tooth, and this is the lingual or the tongue side of the tooth. And then you can see the same thing here for the lower teeth. So these are the upper teeth, these are the lower teeth, and you can see that we process it tooth 1 through 16, and then 16 through 30, then 16 through 1 on the lingual side, and then we'll skip down to 32 through 17 on the buccal side, and then we'll end on the lingual. So it'll always cue this up to happen that way, okay? So uh, when you can also see that some of these teeth are highlighted in red, that means that they've been either marked as missing or extracted on the dental chart. And so it's important to go into the dental chart and do the dental charting before you do the periodontal charting. So if we go to our patient, there's a couple of ways to get into periodontal charting, okay? The first way usually you want to go through is through the chart because again, like I said, if we mark these teeth here as missing teeth, so we'll go ahead and go into the perio chart first. So you can go down here to this little icon down at the bottom, and you'll go up to perio charting, and you're going to see that teeth 1, 16, 17, and 32, it's asking you to do the periodontal charting. But if we select these and we chart them as either missing, so let's do this. Let's say that the upper two teeth are missing, okay, and the lower two teeth are impacted, it's going to treat them the same way. And we can also see that tooth 4 and 10 are have been extracted. So when we go to the periodontal charting, you can see that those teeth are now designated as not needing to be periodontal charted. Okay. The other way to get into this is just right here. We can go to straight to the perio chart here. Okay. So then the hygienist will go ahead and read off numbers to you, and they'll usually say 434, 323, 323, and you can see that those are queuing up as you type in those numbers. Now, if you make a mistake, you can go back, you can click on here, and you can overwrite that to 4, okay? So they'll read off 434, 324, 323, 323, and sometimes they're going to say, uh, we're on tooth number 7, and you'll say, yep, we're on tooth number 7, so you go 323. Sometimes they'll say, I'm crossing the midline, which basically means that they're crossing from 8 to 9. So you're just they're trying to remember where they are, and you're trying to also tell them where you are on the charting, okay? So you'll type in your codes. Occasionally, a provider might say, the patient is within normal limits. So if there's an 18-year-old and they do some spot probings, what they do is they'll say, yep, it's within normal limits. What is within normal limits? That means 323 on the posteriors, and then on the anteriors, meaning tooth 6 through 11, you'll do 212, 212, 212, 212. 11 would be 212, and then 323, 323, 323. Okay. Occasionally, a provider will say, so it's 323s through 26, so you'll do 323, 323, 323, and then they'll say it'll be 212 all the way through tooth 11. So you'll just type those in. Okay. Now, once you're done with the maxillary or the upper teeth, you'll see that it'll automatically cue to the buccal surface of tooth number 31 or 32, whatever they want to have charted there. So you'll go ahead and do your charting. And then the hygienist or the doctor optionally will ask you to chart recession. So you'll click on recession, and they might give you just one reading, which is, oh, they've got a 2 millimeter recession on tooth number 2 on the buccal. And so these ones usually aren't done on every tooth. They're just going to identify the teeth that have these, okay? Then you'll go ahead and click on save, okay? And you can compare your results versus other ones that have been done by clicking on that comparison, but you'll simply click on save, and then you're usually done with the hygienist or with the doctor.